Which one? Well, show me that now. Maybe I am. I didn't know that. What is it you need?
So Churchill Mortgage, they'll need to coordinate with Jim, the name. Lincoln's best. Yesterday. Did a thing on it on Facebook. But your name's up.
No, blankets, I have blankets. It's coming back to me. It's a blanket day.
Yeah.
I need 30 blankets.
How many blankets do you need?
30.
Uh-huh.
Go ahead.
We'll talk afterwards.
Are you at the same place? Did you? You can start it and we can just keep talking. That's all right. Go ahead. Start.
Yeah.
This guy.
What does Sam Philip mean?
Close. Pledge allegiance to the flag of the United States of America and to the republic for which we stand, one nation under God, indivisible, with liberty and justice for all.
Oh, it's on the flash. I know.
Welcome, everybody. So I'll go ahead and take roll. Committee Member Jones.
Here.
Welcome. Committee Member Dr. Horton.
Here.
Committee Member Knowles.
Here.
Committee Member Schumacher.
Here.
Committee Member Grants is on his way. Vice Chair Dalton
Here.
and Chair Ray.
Here.
And then moving on to the approval of the minutes. If there's any discussion. If not, we'll need a motion and a second and a vote.
I move we approve the minutes as presented.
And I'll second those.
All in favor?
Aye.
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 Quick that
It's
goes.
approved.
Very quick.
Yeah, I don't have one to sign.
Oh.
Normally I have like a.
I'm sorry, I have them with me.
No, it's okay. We can do that later.
Yes, we'll do it
Just wanted
after.
to Make sure. I was like, I think I'm missing a step here.
No public.
We have no visitors today, but if our newest committee member would like to introduce herself, we're
Yes.
very happy to have you.
Hi, I'm Wanda Jones, and I'm a longtime Sweet Home resident, born in the hospital here in Sweet Home and lived here my entire life. I'm the operations manager at the Samaritan Medical Clinic here and happy to be joining.
Welcome.
We're happy
Yeah.
you are joining us. Thank you. Yeah, exactly.
Yeah. Okay. Sean, do you have anything for us? Okay,
Just blankets.
just blankets, apparently. Alrighty, old business, community resource list updates. Well, the only update I have is that there is a list. I just need to know where to send it.
You can send it to me. I don't know if you've distributed it to your colleagues already for review to see if anything is missing.
No, I
Okay,
haven't,
you may
but
want to go ahead and do that. And then if you have edits, send them individually to Chair Ray.
if I send it to you, can you, I don't have
Yes.
everyone's emails. Okay, so I'll
Yes.
send it to you to distribute to everyone. And then if there's issues with the links or anything, every resource has a link. I didn't make a separate resource list for Lebanon because they have a pretty great one listed on their website. So I just shared the link for that. But it's all in there. And so I will get that out to Cecily and she will distribute, and then any corrections or changes. We have till April.
Yes.
The April meeting. Do we have to make our appointment to present before so that it's at
It's
least the
been
April?
very relaxed in the
Okay.
past, so don't stress too much about meeting a March deadline.
I don't want to be like, oh, it's April, I got it done. And then it's like, oh, I should have scheduled and
No,
met with
you're
council
just
already.
fine.
And
But if
Okay.
it's done, we can certainly get you on the docket.
perfect. Well, yeah, after I'll review it. And then if there's anything that anyone sees I missed or something new that we've just heard of or anything that's up and coming, the reason we're doing this is so we can have the most extensive list possible and continue to update it and let it grow. So I'm all for corrections or feedback. That's all I have for the community resource list.
Was there any further discussion on the resource list? Okay, then moving on to annual report updates. As you know, around April time, an annual report is technically required from the committee. So I just wanted to make sure you guys are having that conversation as you're moving towards meeting that deadline.
Now that's goals. What we've critique of what we did this year. That's basically it. Present that to the council. Is that correct?
Correct.
Okay, along those lines, I put together a little packet and Dick, I'll just forward you what I had, but I got to thinking about what we needed to do. And so this packet was to go back on what Larry, you had led with the students, had put together that presentation that you sent me. In that presentation is what they did and research in the community. And so my thoughts are that our goals are kind of taken out of that research. To me, there's no sense for this committee to go out, start beating our heads against a wall and trying to figure out what it is we need to do. So in this one, it really talks about the key items. So I just took that portion out of that presentation and printed it out. And then on the back side of this, I attached the city's vision statement and also their goals for next year. So it'll give you an idea, okay, we got to set some goals. Here's what the city's saying, and here's their vision. And one of the things to me was notable, looking at the city's goals and that, there's really nothing specific about health or health care in our community. It's general statements. And I know for a city council is pretty focused on budgets, getting a project done, paving a street. And it's pretty similar, typical every year. And I think for us, it's for us to educate them to look in a bigger picture in a sense. And to me, I'd like to really see this committee propose to them that when they adopt their goals, include a goal that's around healthcare. I mean, it's kind of vague in there. It talks about services, making sure we're services, but I'd like them to stand a little bit stronger on that commitment and support this committee, because I know for me, when we did the health fair, there was no faces that was represented from the city there. And that was, to me, was kind of a disappointment. You know, there was no city manager there. There was no committee members there. And I thought, we've been at this for what, Dick? 10 years? Yeah,
Yes.
we've been at it for 10 years. And so we've stuck it out. And, as a group, I feel we bring a good resource to the city, and I think we can build on that. And I've done a lot of research looking at other cities, and I have to say we're one of the few that has a safety and health committee. And I mean, even looked at big cities, and it's the bigger ones do, and they have a huge budget built into their deal. I mean, we're not New York or some of those big cities. I get that. So for me, when you look at the city's emergency plan, for instance, I think that's coming up. Is that something that we should be looking at as a group and putting our thoughts to that? I know as a safety and health manager for Weyerhaeuser and Willamette Industries, I was responsible for their emergency response plan. And there was a lot of detail in that. We've talked a lot about how do you reach out to individuals in a crisis. I'm not sure that's in the plan or if it's been talked about, but I think we are a good resource to maybe have some of those discussions to support the city and what their efforts are. Because one of the things that this committee or any committee is that we support the city and their vision. So when I look back even at the vision statement, those are vague statements. They're not goals, they're just a statement. So I'm thinking that we could put a lot more behind those and feed that. So I'll hand these out. You'll each take a look at them. My thoughts are probably that either in December, and it's up for discussion, we as a group either use the December meeting kind of as a workshop so we can hammer this stuff out, or we can do an extra one. So
This is the only meeting in December.
yeah. So
We determined that last time.
yeah, well, that's what I'm saying. We need to come back then in January and maybe either have a workshop and take this home with you and look through it and pick out the items so we can come back and have that discussion. Here's the 1 or 2 items we want as goals going into next year, because we really don't want to have 6 or 8 goals. But there's one in there that's real specific. We've talked about it before, is doing some sort of a community outreach beyond the health fair, maybe a more targeted subject like mental health, and bring some guest speakers in. Doesn't have to be a long one. So I think there's some opportunities for us in there to go through and look at this data, underline the ones or circle the ones you think is important, and we can come back as a group and maybe make a motion, adopt some of these for going into next year. So
And when you're speaking about the goals, you mean for your committee itself?
Correct.
Okay.
correct.
And I will say too, I do like the idea of the committee proposing potential goals for city council to adopt as their goals. If you do get to the point where you'd like to do that as a committee, just keep in mind those goals need to be as concrete and accomplishable as possible. And we've struggled with that in the past.
Yeah.
Um,
Well, like I said, we're used to having this conversation, but for a city council, they're not used to that sort of dialogue. Even when we did with working with with the homeless bill, it was people like us that was driving it and trying to educate the city council. Because I remember when we went down that road in the beginning, it was like, not going to happen. And Sean and all of us kept chipping away at it. And then finally they go, we do have some skin in this game, and because it's not going to go away. So I know when I look at the overall health of a committee, even if a goal was, I'm on the parks board, so I'm always brainstorming. These wheels are always turning. I thought, as we develop parks, what's wrong with having 1 or 2 pieces of exercise equipment in every park? I've been to parks where they actually incorporate that. I thought it could be a chin-up bar. It doesn't have to be real expensive adds to a park, but it is a way to bring back health into the community. So I think we got a lot of opportunities for that. That's what I got.
Thank you for putting this together.
Yeah, thank you.
So we're going to discuss this in January. Is that?
This group, I mean, it's up for discussion. What do you think, Dick? I mean, what's your thoughts on it?
I would bring it back for the January meeting. If you can get it to me, I'll give my thoughts as well. But yeah, I don't think we need a second one, but a second meeting. But
Make sure we have it on the agenda for January then.
Yes.
I would think so. Yes.
Have it as
And
a main topic.
I would remind Cecily that the health language was in a previous city goal. And it noticeably was dropped. Actually, Bob and I talked a little bit about it. So something changed. And I appreciate they are difficult to write in a perspective of we can do this, as opposed to, well, that's neat. So
And if you can point me in the direction of that goal, that probably predated me, but I'd be curious to know what that
yeah,
is.
I'll do that.
Thank you.
Send it to all of us.
Maybe.
Thanks, Dick.
I was gonna, on nutrition, key action items. I did contact, we had the, 2 nutritionists from Samaritan here talking. And I reached out to both of them. They were both very receptive. And, I had them come to the senior center to teach nutrition classes. And I had 2 classes there. One was attended by 6 people and the second was attended by like 1. So getting the information out somehow, we advertised it, we pushed it and senior members, but getting people to come out and participate and stuff. And so that's going to be a real challenge.
Yeah.
You need to get something controversial. Then
Yeah, I think the class was on diabetes nutrition. So I figured there's enough diabetics out there that would really interest them. And
I know.
anyway,
You just call it a drawdown, they'll show up.
Too soon.
I'm one of the facilitators for that class. We're
No.
partnered with Samaritan to help
Oh.
offer those. And historically in Sweet Home, when we've offered that class, we always have like a really high no-show rate or a low attendance rate. And so we've tried to work with people before to find out like, is it the scheduling? Is it the time of day?
Yeah.
Like what would make it more accessible? And we've never, at least I haven't from my standpoint, gotten a firm answer on how we can help those community members who really need those classes show up. But it's something that I've been certified in it for 7 years now, and it's Sweet Home, and Lebanon is getting a lot better, but Sweet Home especially is we've always had a very low attendance rate when it comes to scheduling and coordinating those classes.
Mm.
So,
And for myself, I feel like it takes years sometimes for people to realize, oh, that's happening and it's happening every year.
yeah.
And it's something I've learned at the clinic level. It's like you have to work on this for 3 years before people really start to embrace that it's going on.
Yeah.
But yes, I agree. Getting the word out is a challenge.
Yeah, and that's my same experience in health and safety was it took 3 to 5 years to make that cultural shift,
Mhm.
amongst, because,
Well-
I worked around regionally with our company and you'd go in and talk to 100 employees and it's like they just stared at you. But it took 3 to 5 years to really switch that whole culture to adopting, oh, this is a good thing. This makes sense for me. So yeah, it does take a long time.
I won't give up.
No, don't give up.
Well, the other key too, I think, is always making sure you have the right targeted audience that you're trying to address. I mean, that's a moving all the time. But even if these outreach programs we're talking about, if it's simply starting off with going to the Rotary and giving a 15-minute presentation because you have a broad-based leadership there, doesn't hurt to start with changing their thoughts on that culture. So when in their own business respectively, they go back and they start incorporating some of those ideas and thoughts into their businesses.
And I feel like your mention of communication in the emergency plans is also a very valid point. It's a little bit off subject, I guess, but I know that we have experienced a complete cutoff of communication from our organization on a day when our whole system went down. And it was unreal that we were completely cut off. The only way we could communicate, our cell phones were down, was when our cell towers went down, our system went down. We had no way to communicate with the hospital. They had no way to communicate with us. So it's very real that if we had a major event in our community, that we would be cut off, could be cut off on both sides.
I know on the emergency response plan I had written for our company out at Foster at the time, we have that 50-some acre log pond out back. And the question was brought to me, what if the dike breaks? All that 50 acres of water is headed to Foster, and you need to call all of the residents to let them know water's coming. Go like, how's that work? So it is that emergency phone line that goes out, blankets them all. Some you're going to get, some you're not. Someone laughed at me the other day. I said, well, you can call me on our landline or our cell phone. You have a landline? I said, I do have a landline. And it's come in during times when cell was down, the landline was working.
Mhm.
So we've strayed a bit from
Yeah.
the agenda item. So if there's no further discussion on the annual report, if there is, I'm happy to entertain that. But if there's a feeling, a consensus that we want to add something else to the next agenda based on the conversation we're having, I'm happy to do that also.
Yeah, I think it'd be nice to take this home and look it over, and then also just some of our other, like all of our past meeting minutes are online, so different things that we've discussed to come up with. I'm not giving anyone homework, but if anyone would like to bring ideas on goals to our next meeting, I think that's a really good time to discuss right at the start of the year, our very first meeting. What's the plan moving forward, and what do we want to see this committee accomplish?
And it's also a good time of the year because council goals will probably be doing that workshop in March or April. So I encourage the committee to reach out to your counselors if there are priorities that you would like to see them place on that list as well, because we use those goals as staff to help develop the budget.
Well, to Kelsey's point, I'd also, again, encourage the members of this committee, if you have those things ahead of time that you want on agendas, send them to Kelsey or myself, and we'll make sure that you get those. Because I know tonight, our agenda is like, there's really not much on it, but I talked to Kelsey the other day that I would start working with her as a chair to help her support that direction. Because sometimes you get lost in what you're doing and working, and it slips by you real quick. So,
And when do we have to have the agenda done by? Just so if people are like, oh, I thought of
So
something.
legally 48 hours in advance of the
40.
meeting.
Okay, I knew there was a time frame and I just couldn't remember if it was 24 or 48.
If there's any other business for the good of the order.
Might be a good time to talk
I
about
had-
those blankets.
I had a note for the city folks. I went back, was looking at a prior meeting. It was online, but the audio didn't work. So I'd appreciate it if maybe somebody, it could have been me. I don't think so. I checked I went to the city council meeting and I could hear them. But this particular meeting, I think it was the last one.
Okay,
The
we
audio
can-
just didn't work, so.
We can double check.
So, the Oregon Jamboree coordinated with one of its sponsors, Churchill Mortgage, to bring blankets from sackcloth and ashes to Sweet Home, donated to the police department. And those will be used for our upcoming teen sharing tree and to augment some of those. And then we'll maybe do some of those during Shop with the Cop. And I also took 40 blankets over to the FAC shelter today as well. And we have 60 remaining at the moment. The gentleman, Jeffrey Miller from Churchill Mortgage, he's a regional vice president, talked about getting more down here too if we need them. So,
If I could address that?
Mhm.
I know FAC has been thinking about doing a blanket drive
Mhm.
because those huts are cold. There's no electricity in them. There's no heat in them. They are insulated with, I don't know, the R value is probably a 5 maybe. Those huts are cold at night. And when it's below 32 degrees, it's extremely cold. And I know they've asked about the possibility of doing a blanket drive.
Mhm.
So if there are blankets available, I know they would be willing to take them.
And Sean, I drew a blank on that, but I know at our church,
Mhm.
we had probably 4 large boxes of wool blankets. They're sitting in a closet right now. And I can look at those, but those were originally when we started addressing the cold snap. Those blankets were donated for that.
Oh, maybe we can
Somehow
tell
they're
them that.
sitting at our church in a closet. So
No-
I can count them up. I'll count them up.
Church own them?
Pardon?
Does the church own them or who owns them?
They were donated. I think it was
Oh.
back when Janet originally was working through the Lutheran church, and she went out and got a bunch donated. So I'll look back
They've been
and
there a
see.
while.
Yeah, it's been a while.
If you can come pick them up and take them over, let me know.
So I'll count them up and then I'll give you. a
That'd be
number.
great.
But I know they're sitting there, and I said, why are we not utilizing these blankets? So
Yeah.
I'll go back and look.
I know FAC has been concerned that there are no other warming centers in the community. I know that FAC has 30 roughly clients that are cold a lot, but we also know that there's probably another 30 out and about. Is that probably
Yeah,
a fair
20,
statement?
30 in cars on the street. Yeah.
So I don't know how we could maybe open up other areas for warming centers, but I'd like that on a future agenda to talk about because
And the police department is available when it's sustained freezing.
For inside, right?
for inside. Yes,
Yeah.
it's 24/7. They can.
What
ring
I've
the bell
heard
for
is
it.
that only in the lobby,
Correct.
and I don't know how many you could get
Yeah,
into the
it is
lobby. Maybe 5. I guess if you had chairs, you could go a little higher than
Oh,
that.
they can sit there, there's a few of them could fit in there if they need to, but during that ice storm, just by way of information, during that ice storm last January,
Yes,
we had a couple of people use it as far as I could tell, and that was it. The people who were camped outside, they stayed outside.
they didn't.
They never came in.
Yeah.
So,
Well, and we actually opened the gym rigs and also had no one.
yeah, the people we had inside the lobby there were not regulars out there. One had been kicked out of the place he was in the night before the ice storm started, and he was there a couple days.
It would be nice to know if there were churches or other agencies that might be willing on a rotational basis or something to say, we could open up for X number of hours when it reaches a certain temperature.
Well, and if there was some sort of outreach that went along with that, because not everyone is going to be able to access Facebook or any other forms of communication to see, oh, this place is now open. So is there, I know FAC used to do outreach. Are they doing that to kind of targeted outreach to folks?
They do outreach regularly.
Mhm.
They know that we're a warming center, that you can go there. If you get cold, you can go there. We have someone in town today. I just met her and I told her, if you get cold tonight, you can go inside. You got to hit the intercom button.
I know we've spoken previously about this was a conversation a long time ago, but the automatic like push communication, like texts and things that could go out. Is that something that could be utilized when there is a warming shelter or a cooling shelter opening?
So we are in the process of revamping our entire website. And with that, we're adding a texting module. So
Okay.
yes, we are hoping to build lots of different lists in, including that kind of information.
With our transient population, phone numbers change. I almost never have the same number for a person longer than a month. And that it's probably not an effective means of communication, but they're aware of it. In our interactions with FAC's interactions, we definitely talk to them, let them know where they can go. Guys can come inside. So that's happening with that population.
Well, I'm thinking even of when we had Pacific Power decided they needed to cut the power
Mhm.
because of high winds and high heat. We had patients who had no idea how they were going to take care of any of their medications and weren't aware that there was a cooling shelter and fridges and places that they could go to that did have generators and power. So that's kind of what I was thinking of
Right.
utilizing it as is there's lots of people in the community that are housed that we don't think of in an emergency, but they really could use those services.
Something that I just learned over the last few months was that Pacific Power does have a generator program. As long as a doctor will fill out the form for a person that needs the power to run a certain machine, they'll figure out how to get that generator to them.
Reminds me of a case back in 2002 when we had the windstorm come in February-ish. And I was out interviewing people, and out there on 228, somebody had tree down, and we were all out of power. Some of us were out of power for up to 7 nights.
Yeah.
And they needed power to run medical equipment, and there wasn't anything then. But that's interesting to know.
I mean, even if you had a small generator, that's usually enough to run a BiPAP or CPAP or
So I've-
whatever other.
I've gone ahead and placed this item
Okay.
on the next agenda as well. So let's not have a big discussion now. Let's go ahead and agendize it. And then maybe if there are folks that you want to come speak to that, you can invite them to that January meeting as well. So I have goals and I have warming shelters as future agenda items already on the docket.
It might be worth contacting, what's his name? Eric Anderson, and asking him to maybe tell us.
I will ask the committee to invite the guests that
Yeah.
they would like to have attend.
He would be a good one. He's the emergency services coordinator for Lynn County. And I know he's working with rigs to come up with a generator. So when the power is off, there would be electricity at least there. And we're trying to get the same thing at FAC.
One thing you might do also is follow up with Mayor Colvin, because she sent us out an email about a month ago, wasn't it, Dick? About
I think, yeah.
an invite to an outside group, and I haven't heard back from her. I think
Yeah.
most of us said go for it, but so that might be something you
Okay,
would follow
I
up
will
with.
check with her on that.
But I know that was one of the action items she had, so.
Okay. Anything else that we want to put on the list for January?
That sounds like a full agenda right there.
Sounds like a
Hey,
good one.
we got an agenda.
Great.
Wow, this is the shortest one ever.
Chair, it's up to you if you want to adjourn.
As the button
Yeah.
is going off.
Yeah, is there anything else?
Have anything?
I just didn't know if people are aware that Shem got a huge shipment of, they got 22 pallets of
Yeah.
food in. And there was a food drive and they ended up with 1,200 pounds of food that was donated.
Wow.
So, yeah, I'm putting
Good.
away a lot of food last weekend. But anyway, but so they're getting restocked now due to some shortages in the main food bank and stuff.
So Sean, just a quick one. And then we'll get out of here. But when you have these wish list items like blankets and that, I think it'd be good for us to know what that list is. Because instead of coming here and I guess if we knew what the list was, I'd go back to like our church. We got the Lutherans and the Methodists together, and they're real drivers of the Lutheran. So it's like I could go hand this list to them, and I'm sure they'd have a blanket drive tomorrow. I mean, that's just how they're geared. So
Well, that's good for me to hear.
Yeah, that's
Yeah.
that's an FAC wish list, and they have items that we have regularly, and we should get that. We can
Yeah.
maybe
we
come
do
to
that.
this
Can we
committee.
put that on the agenda to discuss? Because I want to talk about like a community closet. So we're talking about like blankets for when it's cold, or even just like hygiene products, things that could be accessed and needed from people in the community that are unhoused, but maybe they don't have someone that's in the school district, so they can't access like the school clothing closet or anything like that. But I know that there's a lot of great things that come out of the clothing closet that isn't just clothes. But what about for everyone else in our community that doesn't have kids? So I want to talk about that next time.
It's been added.
Thank you. And that's all I got.
Call me.
I don't.
Just slam the lid down on that laptop.
can't.
And, oh,
It's a county laptop.
oh.
They might like that.
Gently set it down.
Yeah.
Are you closing the meeting?
Closing the
She
meeting.
closed it.
Meeting is adjourned.
All right. Effective
Thank you,
as,
everyone.
Hey, Dick.
Happy holidays.
Yeah, you too.
Thank you.
Now that I think about it, every time I would go to talk to him, I'm like turning my head from him.